is they can be prone on the mat, and you can have them lift their arm up off the mat and up towards the ceiling, okay? So that's how you have them perform the motion, so they're going purely against gravity. Some textbooks have their arm off the side, they have them come up like this as well. So she could scoot over, and in this case, the elbow, the arm will come off the side, but you gotta come up a little bit closer. See, the problem with this one is you have to get so close that your patients might feel uncomfortable. And you want to keep it close to the side or else you're using abduction. So that's why this one isn't always the best techniques to use, but it is in some of the textbooks. And you have them kind of pull back like this, like they're just starting up an old-fashioned push lawnmower. Good, so they're performing a roll. So they could do a row, so they could do it like that as well, okay? But it is kind of uncomfortable for the patient. They can feel insecure. So I'm going to have her scoot on back over, and we'll go back to the other position. So I asked her to perform the motion, and she was able to do it full range. So now what I'm going to have her do is I'm going to place her mid-range, right here, okay? I've got to stabilize that shoulder girdle again. My resistance is going to be mid-humeral shaft on the dorsal surface this time, and I'm going to try to push her back down to the mat. Okay, can you guys all see? So I'm stabilizing here, and I'm going to push down. Okay, hold and don't let me move you. Ready? Hold, hold, hold. And you can see her shaking a little bit there. So in this case, though, what's nice about this position, if your patient can get prone, is that it helps prevent substitution patterns. So she can really focus on that joint. So I would have given her a 4 out of 5 with that test. Okay? All right. Any questions about that technique? So the same thing goes if she can go through full, and then I go to apply resistance and she collapses. That's a 3. Okay? If she only goes through this amount of range, I need to see how much farther she could go. Okay? She probably right there gave me less than 50%. So if it's less than 50% of her full range, what's that? Right, but we have to confirm it, right? So we would have to get her in sideline. So let's go ahead and have her, we can face these guys, and I'll get behind. So I'd have to get her in sideline, like this. Again, you have to support them, guys. They can't tolerate that drag across their body parts. So you just support and have them try to reach back towards you. Okay? And she went through full range there. She's got real good range in sideline. Okay? All right, so that would confirm that she had a 2+. Okay? A 2 would be that she couldn't have, against gravity, she couldn't really move. She might have had a little bit of shaking, maybe a little bit of movement. Get her in sideline. She's got full motion, and we know it's a 2. If she only has partial motion, she only comes to here. What's that? 2 minus. 2 minus. Good. Okay. All right. What are muscles that I need to palpate back here for extension? Triceps, I heard triceps.
Posterior delta.
Posterior delt. Latissimus dorsi. Teres major. Yep, and there's only 4, just like with flexion. You guys got them. Good job. Good job. All right, so that's all of those muscles are posterior here. So the deltoid you can kind of feel right underneath the inferior border of the spine of the scapula. It comes down and inserts on that deltoid tubercle, so you can feel it back here. Latissimus dorsi is also, and teres major also in that lower portion of the scapula. You can palpate there. And you're just feeling for tension or a little contraction. So if she's not able to move, you're going to have to palpate. Okay? And when you palpate, I like to get in here. If someone's really weak, I like to support them. I like to get up close and personal and support their limb. And then I can just place my hand here and have them try to push their arm back towards me or try to reach back towards me. And then I can palpate at the same time. Okay. All right, let's practice those 3.